Hi, my name is Ling Fei and I am one of the DNP students from MSU and I will graduate in May 2023. My final scholarly quality improvement project is about the Deprescribing PPIs on the Transitional Care Unit at St. John's. I will further explain my project in the following slide. This is agenda for my presentation, which will cover the following topics, including practice problem, background, the purpose of the project, etc. PPIs have become one of the most commonly used medications worldwide and account for over $11 billion in expenditures annually, and it is estimated that over 100 million PPIs have been prescribed per year in the United States alone. There are about 15 million people in the United States use PPIs every year to treat conditions like frequent heartburn, and up to 70% of people who take PPIs have no benefit from them. Omeprazole alone was dispensed more than 70 million times in 2016. 1 in 10 of all patients with ambulatory care visits in 2009 had documented PPI use. The overall proportion of PPI users increased from 5.7% in 2002 to 6.73% in 2016, and the increased trends in PPI use were observed among U.S. adults aged 65 years and older, regardless of gender. PPI prescriptions are associated with inappropriate indications, doses, and durations. Inappropriate PPI uses are identified via multiple observational studies from a variety of countries. Some inappropriate indications for PPIs include empiric treatment of laryngopharyngeal symptoms of cough, throat clearing, globus, and voice hoarseness, which were demonstrated by an RCT that PPIs have no benefit for managing such symptoms. Many patients with GERD are prescribed PPIs for more than FDA-approved duration of 4 to 8 weeks. A national population-based drug utilization study found that patients were increasingly treated for longer durations and at higher doses than recommended by clinical guidelines. PPIs are overused without clear indications in both hospitalized and discharged patients. Further, up to 65% of patients receiving PPI therapy in the United States have no documented ongoing indication. One study found that 60% of patients initiated on new PPI treatments in an intensive care unit for stress ulcer prophylaxis with a lack of long-term PPI indication. This project focuses on the geriatric population, as it is common to see PPI overuse in the older population. Inappropriate PPI use is associated with polypharmacy, increased financial cost, pill burden for older generations, as well as adverse effects. The identified potential adverse effects of long-term PPI use from the literature review include but are not limited to bone fracture, hypomagnesemia, C. diff, infection, vitamin B12 deficiency, community-acquired pneumonia, acute interstitial nephritis, myocardial infarction, pelvic interaction, increased cardiovascular risk, anemia, and dementia. Both prospective and retrospective research studies reflected inappropriate PPI use in various settings, including pharmacies, emergency departments, outpatient settings, hospital settings, and general databases from different countries. Adverse effects from long-term PPI use are evidenced by multiple literature reviews based on RCTs, systematic reviews, and meta-analyses. Although the findings from various studies show a variable level of causality and association between PPI use and the adverse effects, it is recommended to weigh the benefits and risks of PPI use and ensure the appropriate indication, dose, and duration for PPI treatment. It is recommended that healthcare providers conduct thorough medication reconciliation, clearly document PPI indication and treatment plan, and initiate the deprescribing PPI practice appropriately based on guidelines. Further, American Gastroenterological Association also advises that all patients with PPI prescriptions have a regular review of the ongoing indication for use and documentation of that indication by the patient's primary care provider, and all patients without a definitive indication for chronic PPI should be considered for a trial of deprescribing. Farrell et al. Developed a guideline to assist healthcare providers in deciding when and how to safely taper or stop PPIs based on the highest available evidence. They identified deprescribing as either reducing dose, stopping, or using on-demand dosing, and recommended deprescribing PPIs in adults who have completed a minimum of 4 weeks of PPI treatment for heartburn, mild to moderate GERD or esophagitis, and whose symptoms are resolved. Evidence has demonstrated the prevalence of problematic PPI prescriptions worldwide and the lack of clear documentation for treatment plans. This project aims to develop a standardized process for deprescribing inappropriate PPI prescriptions among older populations on a rehab unit at St. John's with clear documentation in EHR. The timeline for this project includes the following: gather pre-education needs assessment survey by December 21, 2022. This part has already been done. Relevant healthcare providers who are responsible for patients on TCU will need to review this information education session and complete a readiness motivation survey by January 7, 2023. The survey will be included in the subsequent slide. I will provide relevant information and education regarding this project to the nursing staff on TCU from January 3rd to January 7th. Nursing staff will help give out the patient education pamphlet regarding PPIs from January 7th, 2023 to March 7th, 2023. I will review patient charts from January 7th to March 7th by March 15th, 2023. TCU receives patients discharged from local hospitals for rehab needs. Evidence shows that PPIs are overused without clear indications in hospitalized and discharged patients. PPI prescriptions tend to carry on after patients are discharged from the hospitals. In addition, the patients who are admitted to TCU are usually geriatric populations with further increased risks of PPI overuse. TCU is a great site with an elevated number of patients on PPIs and an increased need to initiate the deprescribing process to reduce polypharmacy financial costs, pill burdens, and long-term use adverse effects among geriatric populations. This project will also promote awareness of long-term PPI-associated adverse effects and cultivate the culture of deprescribing inappropriate PPIs within the community. AGA guideline for deprescribing PPIs provided 10 best practice advice. I have listed 2 that I think are very important here. First, all patients taking a PPI should have a regular review of the ongoing indication for use and a documentation of that indication. The second one is that all patients without a definitive indication for chronic PPI should be considered for trial of deprescribing. You may use the link here to see the full article, or you may see the attachment I have in the email for the PDF version of the article. Here is the complete 10 advice from AGA guideline. You may pause and have a look. This is the deprescribing algorithm developed by Farrell et al. 2018. I have attached the PDF version in the email. You may download and print it out for reference. The patient education pamphlet is developed based on the information provided by the deprescribing.org. This pamphlet mainly educates patients on PPIs and relevant deprescribing information. Again, I have attached the patient pamphlet in PDF format in the email. Feel free to download and use in your practice. This will be the last survey I have for my project, and it only contains 1 question which will take less than 5 seconds to complete. You may use the link provided in this slide or use the QR scan code to enter the survey page. Thank you in advance for helping me fill out this survey. Thank you so much for listening to this information education session about my deprescribing PPIs project.